In our first story, India revises COVID-19 treatment guidelines, especially for treating senior citizens and those with comorbidities. Also, India's health ministry has asked all states and union territories to immediately increase testing in a strategic manner given the trend of case positivity in specific areas. As COVID-19 cases continue to surge in India, the Ministry of Health and Family Welfare has revised the guidelines for the clinical treatment of mild, moderate, and severe COVID-19 patients. The guidelines issued by All India Institute of Medical Sciences (ICMR), COVID-19 National Task Force, and Joint Monitoring Group under Union Health Ministry for Management of Adult COVID-19 patients said that people above 60 years of age, those suffering from cardiovascular disease, hypertension, CAD, diabetes mellitus, and other immunocompromised stages like HIV, patients of active tuberculosis, chronic lung, kidney, or liver disease, persons with cerebrovascular disease, and those suffering from obesity have a higher risk of severe infection or mortality. The latest guidelines do not include the use of antivirals like molnupiravir and monoclonal antibodies in patients to treat the COVID-19 infection. Medicines like ivermectin, favipiravir, and doxycycline are also not recommended in the guidelines. Antibiotics and vitamins also don't have any place in India's latest COVID management guidelines. Also, the Indian Union Health Ministry says data shows a decline in COVID 19 testing in several states and union territories. Now, states are being asked to increase testing strategically in those areas showing a trend of rising positive cases. All those who are symptomatic must be tested, so also contacts of those who have a laboratory confirmed cases, said Aarti Ahuja, Additional Secretary of Health Ministry. She said identification of new clusters and new hotspots of infection can facilitate immediate action for containment, such as setting up containment zones, contact tracing, quarantining, isolation, and follow up. This can curb the spread of infection.